Well, hello everyone. Lovely to see you all in my iPoster. As you have guessed from all the social media posts that I've been making, it's about female genital schistosomiasis, where we have done a diagnostic validation using a novel recombinant polymerase amplification assay, and our sample being a cervicovaginal lavage. Now, I'm Farhan Kabir. I'm one of the MSc graduates from the London School of Hygiene and Tropical Medicine. To begin with, what is female genital schistosomiasis? It's a neglected tropical disease which affects a lot of female genital tract, mainly because of eggs or the DNA from a waterborne parasite called Schistosoma hematobia. Now, if you look into some of our facts, we see that 237 million, they require treatment globally. This means these are the ones which are affected. However, only 100 million has received about praziquantel treatment. Praziquantel being the drug of choice for Schistosoma hematobium worms. This is why we're getting a lot of cases of 20 to 56 million who are suffering from female genital schistosomiasis. Now, I'll explain more why we're getting all these cases, but to let you know, Africa is the continent which is one of the most prevalent and public health costly diseases in Africa right now. So if we move on to the life cycle, we can see that this is basically a freshwater parasite. Any contact with fresh water will cause the worm to get inside the female body. Now, what is an active infection and what is a chronic infection for schistosomiasis, which will explain why we get FGS or female genital schistosomiasis. Now, active infection occurs when the worm pairs and they produce eggs that are excreted into the urine, or they get trapped into the genital organs. Now, once they get trapped into the genital organs, they cause a lot of pathologies which are related to inflammation occurring for a very long time, thereby resulting in a lot of chronic infections. Once you have a lot of chronic infections in the female genital tract, you tend to get 25% of females that get missed from the system because they have developed FGS. Now, women with FGS who are suffering from FGS, they present with hematuria, postcoital bleeding, infertility, and other pathologies. Now, if we look into the specimen diagram, we can see the cervix and the vaginal areas are the ones which is where the eggs thrive the most. This is why a cervical vaginal lavage is a good sample collection. Now, if we look into some of the pathologies that they create in the genital tract, best to look into our WHO image slider that we have. It's a pocket atlas where they tend to have sandy patches, which could be homogeneous or a grainy sandy patches, or you can also have some of these are grainy patches over here. Now you can have abnormal blood vessels as well, which are quite indistinguishable from somebody who's suffering from any type of sexually transmitted infection, causing a lot of controversies among healthcare professionals in these settings. As a result, a lot of national programs that tend to overlook people suffering from schistosomiasis, particularly FGS, and not to mention the diagnostic challenges that we have. Now, this is why we have active infection, which are either diagnosed with egg microscopy, or we can look for more antigens by looking at an antigen called circulating antigen antigen, which is highly sensitive and specific for active schistosomiasis. But since we are missing out on the chronic one, we tend to use a colposcopy device to look for those pathognomic signs. But however, there are lots of hindrances, as you can see from this picture. But the main hindrance or the main ethical issue that occurs in these settings is the transmission of HIV, because there's a lot of contact bleeding, as you've seen from some of the pictures in the image slider, which causes the HIV to be transmitted. Now, this is why molecular diagnostics is useful. One of them is the polymerase chain, which is quite globally recognized right now for a lot of pathological diseases, including the pandemic right now, and that's why it's a diagnostic gold standard. However, there are lots of challenges, such as it requires multiple cycles, you need a standard temperature, you need to wait until 3 to 4 hours, or you need expert handling as well in a temperature control setting, which is causing a lot of hindrance. This is where an isothermal recombinant polymerase amplification works, because it doesn't have multiple cycles, it just has one cycle, it only works for 20 minutes, and it doesn't require too much temperature control. It can be done in a room temperature, and it doesn't need expert opinion. I mean, I'm not a microbiologist myself. I'm a healthcare professional working in healthcare settings, so I did it by myself as well. Now, I would love to go through the video of it, but if you can spare time, you can go through the video about how the RPA works. Now, what we have done in the study, we've looked into Zambia, which has about around 30% prevalence of schistosomiasis, particularly in Livingstone, which has a median risk of more than 10% and less than 50%. This is why it's an ideal setting. Now, what we have done in our study is, in the BELIEVE study, we have community health workers who do home visits. They'll screen the symptoms for any of the FGS symptoms. They will be given a urinary tube, a urinary collection tube, where we would collect the urine, and then in our Zambert laboratory, we would do both of the tests for active schistosomiasis. Then we would invite such females who are so caring for our study to come for a colposcopy imaging, and this will be followed by our cervicovaginal lavage collection. This will be taken to our two laboratories. One is in the UK and one is in Leiden University Medical Center, and where the qPCR or the real-time PCR will be conducted. And in the Natural History Museum, we'll be doing the RPA, or the recombinant polymerase assay, and the validation will be done in my school. Now, I'd love to go through all the details, but there are just some pictures over here where you can see how the entire study was conducted, and a virtual way of how DNA extraction followed by the RPA, which is the device right here, that shows how the peak in fluorescence gives us the reading in a very quick manner. So what did we find? We sampled about 603 women, and out of them 527 came for the colposcopy assessment. All of them did the urine sample, and 225 was done for PCR and RPA. So what we found out was that when we did the cervicovaginal lavage, we got a positive samples of 16 from the RPA, and the real-time PCR gave only 14 samples. This is why we got a really high sensitivity of 85.7 and a specificity of 98.1, and really small within confidence intervals. As a result, we have done a secondary analysis where we have looked into any positive samples or true positive samples for both RPA and qPCR. We compared it with a colposcopy device, and we found that at least 42% of them were still missed when we do just a colposcopy examination. And from there, we found a high correlation with, high association with hematuria, but we still found some association with vaginal ulcers, vaginal sex, and also vaginal discharge, meaning that if a person who has any of these symptoms should not only be diagnosed for sexually transmitted infection, but FGS should be taken into consideration. And finally, for the active schistosomiasis, when we take only the active schistosomiasis samples of urine for CAA, we still get the same comparability of sensitivity and specificity, meaning that the RPA can be a really good tool in such endemic settings, even for active schistosomiasis diagnosis. I'd love to go through these beautiful charts over here, but we're quite restricted in time. But to let you know that this is a diagnostic device which is quite comparable to RT-PCR, and it can be used for both, or a proxy for the CAA as well. Now, the good thing is that there might be some diagnostic challenges, but logistical challenges, but these pictures by Danish and colleagues who have said that these devices can be portable into a PET, and it just requires a solar external battery supply. Now, I'd love to go through these videos, but we are still updating our study. We're going to be using, instead of a cervicovaginal lavage, a simple genital swab by the females themselves, or we will use another diagnostic algorithm which we will incorporate not only RPA, but we will also incorporate the CA to see if it works in the field. And thank you again for coming to my iPoster. If you have any questions or comments, please tell me in the chat box. Thank you.